Yay Networks.
Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban. Today's topic is liposuction. That's right, liposuction. It is probably, if I'm not mistaken, the most popular cosmetic surgery in America. It may be neck and neck with breast augmentation, but sure as hell quite popular. At any rate, we're going to talk about everything A to Z about liposuction. Those who know me, follow me, and have listened to me know that liposuction to me is a very treacherous procedure. I do it very seldom, in only candidates I think will get a great result. So let's explain why it's so popular and why I try to avoid it if I can. All right, so what is liposuction? Let's start with the definition. So liposuction is the suctioning of lipocytes, which is suctioning of fat cells. So essentially, you make holes or port sites or cannula sites, which should be really 5 millimeters, meaning half a centimeter, in various areas. And then you use a cannula, which is a long straw, for a lack of better words, that's blunt, meaning it's not sharp at the end, that has openings depending on how aggressive you want to be, one or few openings. And then you do a back and forth type motion in which the fat is slowly plucked out of your body, entering a tube and going in a canister. And there's a vacuum, aka a suction, that does the removing. That's the basic principle of liposuction. You go into areas with fat and you use this cannula and then you suck out the fat. Over the years, liposuction has changed dramatically, as is the case with many other technologies. And what are the things that have changed? Well, you can't just go in and suck out fat without using some kind of solution, because if you do that, then liposuction is very bloody and then can be very dangerous. So many years ago, the liposuction or tumescent solution was invented, in which you inject the tissue you want to remove with this solution, which generally is some kind of saline solution, some epinephrine, which prevents the blood from the blood vessels from bleeding and making them tight, and some type of anesthesia of sorts. So that's the solution. And then you use different varying types of technologies to remove it. So back in the day, the main type was SAL, suction assisted liposuction, which means you go in, you use a canister and a wall suction, and you remove the fat. What happened is they started to realize, well, we're not that efficient. We can remove more fat. And various technologies have come along the way. They included things like laser liposuction, in which there's heat at the cannula end and you emulsify and melt the fat before you suction it out. There is vaser or ultrasound technology, where again, you're heating up the fat prior to sucking it out. There is power assisted liposuction, where there is a robotic machine that goes back and forth so the doctor doesn't get tired and is a bit more aggressive, and so on and so forth, and so on and so forth. Essentially, the goal is to be more efficient in removing the fat, create less damage, less bleeding, and then the holy grail, tightening of the skin. Because the main issue historically with liposuction is you go in and remove the fat, but what the heck is going to happen to the skin? And the skin then usually gets looser. Like if you lost 100 pounds, what would happen to your skin? It'd get looser. So who cares if I remove the fat or you lose it by diet and exercise? Your skin still is deflated. So if I go in and I take out a pillow out of a pillowcase, the pillowcase is going to become deflated. So the big issue with liposuction has been the skin and how to manage the skin. And essentially the majority of the technologies have been trying to find out the solution of tightening the skin. I would argue, and it's just my opinion, that we are not there yet. I don't think the technologies that we currently use leave the skin in such a great fashion where they looks great naked and in front of people. And I'll get to that. So that's the technology. That's the varying iterations of the technology. So how is it done? It can be done awake under local, meaning you just stick this tumescent solution, which has numbing in it, and you're totally awake, all the way to general anesthesia. I do all of my liposuction with patients under general anesthesia because I like that controlled environment. I don't like doing things in my office. I don't like things doing where you're semi-awake, semi-sleep, and moving. I just don't like it. It can be done. I'm not a huge fan of it. So who are the candidates? Basically, anyone who has fat that wants it removed, right? Wrong. Just because you have fat and you want it removed doesn't mean you're a good candidate. Remember, it's more than just fat. It's about fat and skin. And if you're a woman with 4 kids and a bunch of loose skin and you go liposuction your belly, your skin is going to look awful. If you're a person who's lost 100 pounds and you go liposuction your inner thighs, it's going to look awful. So a candidate is someone who has excellent skin, tight, and some mild or moderate amount of fat to remove. Liposuction is not designed to make you lose weight. You'll lose nothing on the scale. It's a contour surgery. It's designed to, change the contour. You see this part of my saddlebags? They stick out a little bit. I have a little bit of love handles. My bra straps are a little thick. It's just there to contour or finesse the body. Today, it's being way overused, and it's used to literally change a square person into a curvy person. So the ideal candidate is somebody who has amazing skin, who needs a small or moderate amount of fat removed. So essentially, that's liposuction in a nutshell. So what seems to be the issue? So where I have the issue with liposuction is going to be in all of its complications, all of the risks, all the issues it has. Liposuction has gone through the roof in recent years because now you have the most incredible opportunity. You have liposuction, which is like, oh my God, you're going to remove my fat? That's fantastic. And then you have fat transfer, which means you're going to take the fat that you're going to throw it in the garbage and stick it somewhere that I need it. Are you kidding me? Oh my God, this is like from the heavens. And that's fat transfer. Fat transfer is moving fat from one area and sticking it into the other. The most common is a BBL, a Brazilian butt lift. We take the fat from all over your body and stick it in your butt. I have 100 episodes on this. You can do it in the breast. You can do it in the face. You can do it in the lips. Essentially, you can take the fat and inject it anywhere. With the advent of fat transfer, the aggressive nature in which liposuction is being done has gone through the roof. So what happens is now you're not just liposuctioning because you want the area you're liposuctioning to look good. You're liposuctioning because you need the fat because you want somewhere else to look good. So what's happening is that you're over liposuctioning the areas that you're liposuctioning so you get more fat so you can stick more in the butt or more in the breast. And essentially the areas you're borrowing from, the donor sites, are getting more damage than they ever were before. So let's go through this together, shall we? What are the risks associated with liposuction, and why am I always so cautious, reluctant, and very careful about who I do it in and how I do it? Number one most common side effect or risks associated with liposuction is irregularities, rippling, contour deformities. Let me say that again. Irregularities, rippling, and contour deformities. That is, when you look at the area you liposuctioned after 1 year, when the swelling is completely gone, the area you suctioned has this undulation or wave-like cellulitic looking nature to it, whereby which it doesn't look smooth in lighting. Every person who's had liposuction who is listening to this podcast knows exactly what I am talking about. Why is it that if this is so common, it's not so heard about? Because when you go online and you look at the damn photos, these are the problems. Number one, the before and after photos are usually done 3 to 6 months later. The area is still swollen. And when the area is swollen, it looks fantastic. Number two, you can never see irregularities in flash photography. When you shoot the before and after photos, it's got flash in it. Have you noticed that the before photos are got like overhead lighting, really shitty lighting, and then the after photo is glamour photo because it gets rid of all the irregularities. So the reason why it's not as commonly discussed, except for when you read these blogs or when you talk to a friend, is because it's a late issue. It's an issue that occurs 1 to 2 years later. God forbid you show up at my office at 4, 5, or 6 years. So the number one complication is this ugly, irregular skin. So what are the areas, actually? What are the areas that you can liposuction? I digress for a second. I'll come back to loose skin. So the areas are essentially everywhere. Under your neck, that's called submental lipo. Your arms, your upper back, which is your bra strap, under your arms, your lower back, which are your love handles and flanks, your buttock, your hips, your saddlebags or outer thighs, your inner thighs, your stomach, and people are even liposuctioning their calves and ankles. So the only thing I've left out is literally your face and your hands and your feet. So you can literally liposuction almost anything. That doesn't mean you should, and it doesn't mean it'll look good. So loose skin occurs in a lot of areas. Anywhere your area of skin is a little bit soft, you're going to get loose skin. Your arms usually have loose skin. Your inner thighs get that crepey skin. Your lower abdomen, not so great. What areas tend to do a little bit better? Your love handles tend to do better. They're curved and thicker skin. Your saddlebags tend to do a little bit better from a loose skin standpoint, not from an irregularity standpoint, because it's thicker. But altogether, every area is prone to loose skin and every area is prone to irregularities if your surgeon is aggressive. Scars. Oh my God, I cannot tell you the number of people I see every year who come to me from everywhere wanting me to revise the scars, those little stupid small things that should be irrelevant and disappear. So what happens is your surgeon pokes a hole all over the place, lots of them, and then there's friction. The back and forth causes a burn on the skin where the hole is. And a lot of surgeons leave those ports, those areas open. So they heal horrible, thick and brown and obvious. And you're walking with your bikini on the beach and you got all these obvious liposuction scars. Can you imagine? Well, there's a lot of people that have that. And so there's a telltale sign of liposuction. So even though they're tiny, these cannular sites, they can be very, very obvious. I refer to burns. So a lot of the new technology uses heat because the idea is to melt the fat and heat the skin. You heat the skin so it tightens so you don't get loose skin because it's a big issue. Well, a lot of people, that heating the skin actually burns the skin. You get a burn. It creates scar tissue and adhesions. The skin around the port burns if you go back and forth too many times. So burns is a real big issue. Another one, asymmetry. Remember, a lot of these areas have two sides, like you have two arms, two legs, two love handles. So if you don't get it right, which often is the case, you're going to come in and say, my one thigh has much more fat than the other. My left inner thigh is fuller than my right inner thigh. So asymmetry is a significant problem, especially when these techniques are done very aggressively. Now, let's see. What else do I have? So, those are really some major issues that you have with liposuction. The issue isn't that you shouldn't do liposuction. I think the issue is that liposuction, number one, is being done way too often in the wrong patient way too aggressively. And as a result, a procedure that it was designed to finesse, do a little contouring, is now becoming a major culprit in complications. And I can tell you, once you have these irregularities or ripples or loose skin or divots or burns, they're very hard to, almost impossible to correct. It's not like other things where if you show up, I can fix it. There's no fixing most of these things. So you're better off understanding liposuction and being smart about it and making good choices. So hopefully that was a educational, overview of liposuction. Be smart and educate yourself before you run out and do it. And join us next week. We're going to have yet another interesting episode of Plastic Surgery Uncensored. Thank you always for joining me. If you like the show, please share it with your friends, family, subscribe, download, and follow us. Until next time, I'm your host, Dr. Rady Rahban.
Thank you for listening to Plastic Surgery Uncensored with Dr. Rady Rahban. We would love your feedback. If you enjoyed this episode or if you find our podcast helpful, tell us why. Leave us a review and make sure you subscribe on your favorite podcast platform. If you have a topic you would like for us to discuss in an upcoming episode, please reach out to us on Instagram at Dr. Rady Rahban, on Facebook at Rady Rahban, or at RadyRahban.com.